Okay, so last time I showed you all my IFAK, which is individual first aid kit. I think what I did not specify was exactly what it's used for. So an individual first aid kit, a blowout kit is what I learned it as, is to be used for you. In other words, when you put your kit together, you have it on your body or near yourself. If anything happens to you while you're out doing hood rat things with your friends, they are to use your kit for you. So that means everybody you're with should not only have a kit, but everybody that you're with should know how to use that kit. Now, what I wanted to go over today was the kit that I use for groups. So the last time I used this, and this is, I guess you would call it a civilian medic bag, because not military, we're civilian, right? So this kit I used shortly after the incident that happened in New Orleans on Bourbon Street for New Year's. And we were having a parade. Everything was still kind of, tension was still a little high. I just made sure I had this out just in case. So everybody that was involved in the parade in my group, anything medical happened, we'd be okay. So I'm going to go over what I keep in this bag. And this bag is not for myself. This bag would be for a group of people. Like I said, if we're out at a parade, somewhere like that, and I have, 5, 10 people, whatever it is, who would be relying on me if an emergency happened, or relying on someone if an emergency happened, I would have a bag like this. So let's go into what's in it. When I open it up, it comes down like this, really easy. This is just a regular first aid kit. American Red Cross first aid kit. Has all the things that you would expect in a first aid kit. A little bit more. There's a tourniquet in here, emergency drinking water, Celox granules, and we'll go over that one day. Emergency poncho, everything that you would expect. Band-aids and nitrile gloves, hand warmers, face masks, regular stuff that you would find in a first aid kit. So that's the first thing, just a regular first aid kit in here, right? Now this is a portable stretcher. Anything happens, and might be a little hard to show out here, but just portable stretcher, right? If we need to carry anyone who can't walk themselves at the time. So that's thing. Next thing I just have is a splint. Broken bones, arm, leg, splint. So that's the first things that show up in the main compartment. Now let me show you what's on this outside compartment. So in this first compartment on the outside, first thing I have is, this is an all-weather notebook. So this you could write into even if it's wet, if it's raining, anything. You got a Sharpie. I have shears, scissors, shears to close off. And then the next thing I have is one of my favorite things. I talked about it in my IFAK kit, and that is Israeli bandages, or pressure bandages as they call them. And I have probably too many in here. I have 6 of them right here. Probably have some more somewhere else in the kit. Here in this top pocket, I have gauze, mostly. Gauze, bandages, waterproof tape, more gauze. Never have too many trauma shears. And things like that, right? Also have another all-weather notebook and a Sharpie, because maybe working with someone else who needs their own. On the outside here, I have several tourniquets. And remember, I had one tourniquet already in my first aid kit, but I have 2 cat tourniquets, and then 2 rat tourniquets. Now, these really get, some people say they're good, some people don't like them at all. So these are in here just in case. I've never actually used one of those. On this side, I have some waterproof bandage tape, and I also have self-stick bandage wrap. Over here, I have different allergy medicines, aspirin, ibuprofen, things like that. Just basic medicines that would help, in a pinch if you're out with a bunch of people. And I'm someone who always has allergy problems, so definitely keep allergy medicine on hand. In this pocket, I have a pack of PVC gloves and an Ambu rescue mask, just in case we have to give someone first aid. An Ambu rescue mask. Okay, in the next pocket is basically bleeding control outside of the tourniquets. Now, I already have some Celox in my regular first aid kit, but in here I have some hemostatic gauze. I have a quick clot trauma pack, butterfly closures, and a few different types of wound closures that you could use in a pinch. And also, basically, this is more something else that's like Celox, stop the bleed, little bottles of it. So this next pocket is for airway. So I have some nasal pharyngeal airways, several different sizes. Then I have some Berman oral airways, also several different sizes. So in this pocket, I have chest seals. I have about 4 of them because you should always have them 2 at a time. These are halo seals, and these hyphen, vent. And that is for sucking chest wound or tension pneumothorax. The last pocket that I have is just a few sodium chloride injections that I would use to flush out a wound or just to clean off something before I put a bandage on it, if I needed to. That's about it. This is the kit that I would use if I was with a group and we were out doing anything really. It's if I'm at a festival, if I'm anywhere where I may be in charge of helping take care of people, I would always bring a kit like this with me because I never know what's going to happen. So any questions, leave them in the comments.